This time I'm going to do a sub-Q heparin injection, and so I gathered my supplies. I have a 100-unit syringe, my insulin, alcohol swabs, and gloves, and also a 2x2. And so first and foremost, I am going to check the MAR and make sure that there is doctor's ordered for insulin. And then I'm going to check my 6 rights, the right patient, the right drug, the right dose, the right time, and the right route. And they do have those things. So I am going to go into my bedroom. I'm going to pick up my insulin vial. I'm going to make sure that it's not cracked, it's not broken in any way, it has not expired. If it's open, I'm going to make sure that there is an expiration date. They're good for 28 days after opening. So I'm going to take my alcohol swab. I'm going to open my insulin vial, take off the top, and clean it, the top of it, with an alcohol swab. Okay, so then I'm going to open my syringe. I am going to put as much air in as my dose. I'm going to take my vial. After I warmed it up by rubbing it in between my hands, not shaking it. Mixed it up, not rubbed. I warmed it up. So I'm going to turn my vial upside down. I'm going to carefully insert my needle. I'm going to insert the air. Then I'm going to draw out that amount. Insulin away. I will recap my needle using the one-handed technique. I will have another nurse double check my insulin. I will enter my patient's room. I will identify my patient by 2 identifiers. I will explain the procedure and what we're going to do. So here's my patient. My patient is sitting upright in her bed. I'm going to perform hand hygiene, put on my gloves. I'm going to clean the site with an alcohol swab. So my patient is not a large patient, so I can go in at a 45-degree angle. I have my insulin. I'm going to place the cap on the table, lay it over there. So I can go in at 45 degrees. I hold her skin tight. Slowly administer the medication. Remove my needle. Recap it with the one-handed technique. I'm going to dispose of this properly. I am looking at her site. I'm going to dab it, make sure that there is not bleeding. Okay. So then I'm going to remove my gloves, perform hand hygiene, and I'm going to document the proper things like where I put the insulin after I am finished.